Hello, everybody, and welcome to this episode of Quick Tip Tuesday. Today, we're going to be covering how to be a little bit more efficient in Epic ASAP using macros. Macros are similar to dot phrases or smart phrases in Epic. So two examples I've set up for you already are going to be starting out some IVs. So let's say that we did start an IV here in the left AC. We're going to go today and now, and it's a 20 gauge. We'll hit accept here. So the efficiency comes in the form of macros. Macros can be found by clicking on more and then macro manager. And you can see that I've already created one. This one is for whenever an IV goes rather uneventful, and it's pretty much going to be the same thing that you would document with a normal IV insertion. So you can see that my saved macro is already here. So if this was already created, I can simply click on that, and then I can add the additional things that might have been done, whether you did send for analysis or did a draw and hold, or if you were unsuccessful. You can always alter the things that come in the macro, so it's not a one-size-fits-all. It gives you kind of a head start, reducing your clicks. So that's that example. The other example that initially gained my interest in this efficiency was the neurointensive assessment, particularly in when the patients are intubated. This is separate from the NIHSS. In the NIHSS, we do not do unable to assess. We will, for the NIHSS, use the difficult patient scoring tool. So for the neurological assessment intensive, I've already created a macro. This is named unable to assess sedated. So you'd put unresponsive here. It's already populated, intubated, unable to assess for most of these fields. I did not do anything with the pupils because that would require its individual assessment every time. However, if a patient is sedated and we can't get a true baseline of what they are doing, musculoskeletal wise or neuro, unable to assess for all fields if it were true. And again, if this patient was sedated, but they were able to grip your right hand, you can always alter it to meet whatever the patient is doing. And you can always put in a note to clarify whatever it is. But in the event you were doing these Q15 and your patient was intubated, in my particular example, you can always just use this to be more efficient. Thanks for watching.